I also now want to talk about the fact of when you're using resin-modified glass ionomer, the cleanup is actually really easy. That's one of the wonders of using it and why so many people want to kind of fall back to doing that aspect of final cementation rather than bonding, adhesively bonding them in. So I want to talk about a few little tips and tricks that if you do have to use Unisem, what you can do to make placing or removing the cement a little bit easier. I'm one of these people that I'm very systematic in how I prep. I have a series of burrs that I use in the same line every time. When I design my restorations, I have a design sequence that I use, the same tools to design. And when I'm placing my cemented restorations in, I clean up my restorations pretty much the same way. So the first thing I do is I use a floss actually made by Johnson & Johnson. It's called Total Care here, you can see it. And the reason that I love it is because it's this rubber-based floss, so it does not kind of shear into tiny little threads, which end up getting a lot of times stuck in the patient's, in between their teeth, and you see them like picking at it with their tongue or they just drive themselves a little bit crazy. So I just like the fact that if this doesn't go through, it just tears and it's done. But the other thing I like it for is I take a piece of articulating paper and I'll just fold it over the floss and I'll run it down the floss. Actually, my assistants, they do this for me and it's laid out on the tray just like this. So I have the articulating paper, the ink basically on my floss ready to go. So you'll see an image of an Emax crown that was done from one of my previous presentations that I did just because I had it in there. And you'll notice when I floss through, it makes marks exactly where the restoration is binding, and I know exactly where to adjust. So if your zirconia crown comes out of the Speedfire and you go to try it in and it's just a little bit too tight, don't arbitrarily just start taking off those marks and not knowing exactly where that contact is. Using a tip like this will make it very accurate in where it's getting held up and where you need to reduce. So that thing those restorations will drop and you're not going to worry about possibly opening up your contact in another spot within the adjacent, how they're touching adjacently. The other thing I use a lot is from Parkel. It's a separating medium called Blue Sep. And I really like Blue Sep because one of the issues that we have when we're bonding in these restorations is that the material not only goes down into the gum tissue and things like that, but it comes up through the contact a lot and almost up over the marginal ridges. So next thing you know, you have your adhesive cement that is now stuck to both the adjacent tooth, the interproximal of your restoration, and you just can't get a floss or anything through there. So I like to paint the restoration on the interproximal along the interproximal wall of the restoration I'm doing, and also the interproximal of that adjacent wall. So I would do it on, if this was say number 30, I would do it on the distal wall of number 29, I'd do it on the mesial wall of 31, and then I would go ahead and I'd put it on the interproximals here. What that's going to do is it's a separating medium. Unlike something like Vaseline or KY or things that people use as a separating medium, it's got a color to it. And it's gel-like when it comes out. And then when you place it on, it almost gets tacky, so it doesn't run. So the big thing you want to make sure, I don't want to get my Blue Sep, which is a separating medium, underneath the margin, because then I'm going to have a potential for a debond. I just want to place it in all aspects of that interproximal, so when the cement comes in contact, it will just flick right off. And it makes cleanup so much easier for you. The other thing that I recommend highly using are, by the Butler Gum Company, the soft picks. I don't know if you use these. We give them out to our hygiene patients all the time for patients who don't like to floss, which who doesn't like to floss? Everybody likes to floss, right? So in this case, for those that don't, those one or two people in your practice, we hand these out. But for us, I find that I use it the most for interproximal cement cleanup. I make sure I'll tack cure my cement. I'll clean off all the perimeter. I'll make sure that there's no unset cement on the underside. And I'm going to hold my restoration down very firmly. And I'm going to push my soft pick through the interproximal between the contact and the gum tissue, and those little kind of like Christmas tree branches that are on these things, they just grab cement and they push it right out of the lingual. So I'll tend to pack a cord and I'll leave a cord packed in when I seat the restoration down. And then I'll put the blue Sep on the adjacent teeth, and then I'll seat the restoration down with the cement, and I'll tack cure it. And then you'll see here, in this case, I took my finger off so I could take a picture without my thumb in it, but you'll see my thumb was down and I started to push this through, and you can see all of the cement that gets stuck within that soft pick. You see I packed cord, and why did I do that? Well, it's gonna stop your cement from getting subgingival. So all I do is I get through there, I tack cure it again for about 5 seconds just to make sure that the cement is nice and set, pull out my cord, put a little glycerin on the buccal and lingual walls of that restoration, and then go ahead and do your final cure. And then everything should come off really nice, and you'll have these beautiful margins that will, avoid the oxygen inhibited layer. If for some reason you get something stuck in between, then you can use the contact ease. These things are wonderful. There's a lot of different companies that make these saws. They have the Cerasaw and things like that. I like these because my fingers fit nicely on there. You have a lot of control going back and forth, and they have ones with serrated edges like these. They also are great for like interproximal reduction, or if you have a little piece of cement adhered, you can kind of follow it like a C shape and get below and remove any residual cement. So they're a wonderful addition to your cleanup and your armamentarium. So with that, I hope that working through this gives you some ideas of why we want to use zirconia, how to handle it in your practice, how to get it into the oven, get it out of the oven, how to pre-polish and then do your final polishing, and then how to make sure that making the cleanup, which can be some of the most frustrating part of what we do, a little bit easier for you on your day-to-day practice. Having the ability to do chairside zirconia in my practice is something that's very, very wonderful for us. It allows us to use a really wide armamentarium in our practice that allows us to do chairside dentistry same day. And I got to tell you, my patients love the chairside dentistry aspect of this much more than I do. So with that, I hope these tips and tricks help you back on Monday morning, and I appreciate you taking the time to listen. Thank you very much.